Hello and Assalamu alaikum. Ultrascan Diagnostics. This is the CBCT of the patient that you had requested. The 3D rendering shows a completely atrophied maxilla and an extremely atrophied mandible. Moving to the panoramic view of this patient, on the panoramic view, we can see that the maxilla does not show any solid bone, whereas we do have significantly solid bone in the anterior mandibular region. Now moving to the transaxial view, the transaxial view is going to show us the tooth from a proximal aspect. I will take you through the maxilla from the top right. This is the top right region of the maxilla. And as we move towards the midline, this is the molar region. As we move towards the premolar region, this is, you can see how thin the ridge is. It's absolutely atrophied and thin ridge, which does not even support um, um, any kind of bone structure. Moving to the anterior region, this is the central incisor region. As we move in the midline, this is where the incisor foramen will be. And as we move towards the left side, the ridge shows no bony structure or architecture. The molar region, the maxillary sinus, and the tuberosity region in the upper left area. So the maxilla does not support any bone. We do, however, have some form of bony architecture in the lower anterior region. So this is the canine region where we approximately have 4 mm of ridge width and approximately 9 mm of ridge height. Moving to the central incisor region, the bone slightly gets better, and where here we can see we've got approximately 3.9 mm of ridge width with 11 mm of ridge height. Moving to the lower left region, in the lower left region, the bone shows a little bit better architecture. Here we approximately have 5.1 mm of ridge width with approximately 9.9 mm of ridge height in the lower left lateral central incisor region, and in the canine region, the bone starts to atrophy. So we don't have any significant bone, but approximately canine and premolar region, we have 4 mm of ridge width with approximately 9.5 mm of ridge height. So if the bone quality in the lower anterior maxilla is D2, lower anterior mandible, sorry, is D2, whereas the bone quality in the upper maxilla is absolutely D4, and we don't have any ridge width or ridge height whatsoever in the mandibular region. So if you have any further questions regarding this case, please feel free to reach to our team. Thank you very much.